Let's talk briefly about people on kidney dialysis and they need access to their blood. Okay? The kidneys filter the blood, take out waste products. That can be done with a machine. Now, for a person on dialysis, they're doing this typically twice a week, and they have to have these big IVs put in there 3 times a week. Oh my goodness. And you need access to their blood over and over and over. One of the procedures I believe vascular surgeons like you do are things called fistulas, AV or arterial venous fistulas, where you've taken a vessel or a tube and connected a big artery to a vein, usually in the arm, I believe, and that allows them to get blood out and put the cleaned up blood back in the body, right?
Yes, absolutely.
So tell me about these AV fistulas that you create.
Well, unfortunately, in this country, we have a lot of patients who develop kidney failure, and the two primary reasons are high blood pressure, hypertension, and diabetes. And so in that population of patients, there are really three main ways for you to continue on and to receive a therapy that takes the place of your kidneys. And those therapies are just what you were talking about, which are called hemodialysis access options. And I'm gonna come back to that. And then you can also put a catheter in the tummy. It's called peritoneal dialysis. We're not going to get into that really, but and then you can get a kidney transplant. But for most people in this country, they're going to be on a hemodialysis option. And you're right, that's where we connect an artery to a vein, or we put in some type of synthetic graft as a substitute for a vein. And what we're doing is we're creating a high flow circuit from the arterial to the venous system. And that allows the dialysis units, and we have many, many here in central Missouri, it allows the dialysis units to access that circuit with 2 needles, one to withdraw blood. It goes through a kidney machine that cleanses the blood, and then it's delivered back to the patient through the other needle. And a typical treatment will take about 3 hours. They need 3 treatments per week to do the work of the kidneys. It's not a perfect treatment because you're doing the work of the kidneys over 48 hours. You're now cramming that into 3 hours.
Yeah.
And so if you'll remember, the kidneys take a lot of fluid off of us each day. And so we're taking off fluid in 3 hours that would normally be taken off in 48 hours. So it's tough on patients, but we do an awful lot of that. We call those accesses the patient's lifeline. And as a matter of fact, if something goes wrong with that lifeline, then it's an urgent situation for patients. Now, it's funny you bring that up because as I was coming in here today, one of my partners on call called me. There are literally, she's had 3 consults today for that exact thing. And so
to put one in or to fix one that's clotted up that needs to be redone.
3 that need to be redone that are clotted, and that may mean going in and removing the blood clot with either a catheter, what we call a percutaneous, or an open technique, or it may mean modifying the lifeline, or it may even mean putting in a new lifeline. So and then there are times where we temporize patients. We can't get any of those things going in a timely manner, so we put a catheter in. And through the catheter, the patient can receive a dialysis treatment while we're trying to plan.
A big vein somewhere else, maybe
yes,
in the neck
a big vein in the neck, the jugular vein or the subclavian vein, typically, while we're trying to figure out what our options are. Where are we going to put a new access?
Because it seems those keep you very busy.
It is. It's you know, the primary thing. Well, first of all, the thing that led me to vascular is the diversity. You just get to do so many different.
I've just done the whole body with you here.
And I'm going to be honest with you. Yeah. There are many things that we're not going to talk about that I just love to do. And so for a typical month, I probably would do, I'm going to say 50 different operations, maybe 75 different operations. And it's just so fun to do that. Yeah. We're not doing the same thing over and over and over.